Hearing loss needs to be accurately diagnosed. There are multiple forms of hearing loss. There's a type of hearing loss called a conductive type of hearing loss, and then a type of hearing loss called a neural or sensory neural type of hearing loss. And then there can be varying forms of that. There can be some mixed types of losses where patients will have both a conductive and a sort of nerve type hearing loss in the same setting. So it's very important to make an accurate diagnosis as to what's actually causing the hearing loss. There are some forms of hearing loss, such as conductive types of hearing loss, that can be treated with office procedures. Patients can present with a large wax impaction that can be removed that can drastically improve their hearing. There are holes in the eardrum, which is also known as an eardrum perforation or tympanic membrane perforation, that can cause hearing loss. You can have problems with the little bones behind the eardrum that become calcified. That can also be a type of conductive hearing loss. All of these things can be improved with either a procedure in the office or some type of surgery. For patients that have more of the nerve type loss, those patients really have one option, and that is to consider a hearing aid. Or a patient with a mixed type of hearing loss can also consider a hearing aid. Hearing aid essentially amplifies the parts of hearing that a patient is deficient in. So the difference between a hearing aid and an amplifier, I get asked that question a lot, is why can't I buy the very cheap hearing amplifier that I saw online or I saw in a newspaper ad? The problem with the amplifier is it enhances all sounds. A hearing aid very selectively can amplify the parts of hearing that you're deficient in. So it's a very targeted type of therapy. A lot of the more advanced hearing aids have features such as noise reduction that can really filter out some of that background noise that patients tend to struggle with when they use just a simple amplifier. Some patients with conductive type of hearing loss will choose not to have a surgery if the surgery is going to be an invasive type of surgery, and can instead choose to use a hearing aid. So essentially, if there's any type of hearing loss, a hearing aid can be used to improve that patient's hearing.